Hey guys, this is Dr. Hub. Today we'll look at the CNS tumors, and we are specifically looking at the histopathological findings. So the first one being the pilocytic astromas. So the pilocytic astromas, it is nothing but a biphasic architecture. So it has a biphasic architecture. And what does it contain? It contains a loose microcystic. So it contains a loose microcystic component and dense fibrillary areas. Then comes the bipolar cells. So these bipolar cells is also known as the tumor cells. And how are they different? The tumor cells are nothing but it is thin. It is thin. It is a long hair-like processes. So it is thin, long hair-like processes, and they are GFAP positive. Next, there is the Rosenthal fibers. These Rosenthal fibers, they are nothing but a eosinophilic. So they are nothing but they are eosinophilic corkscrew shaped inclusions. And looking at the eosinophilic granules, they also have the eosinophilic. There is eosinophilic granular bodies. So these eosinophilic granular bodies are nothing but mulberry-like lesions. They are mulberry-like lesions. So let's recap. There is a biphasic architecture. Next, there is also a bipolar cells, which are nothing but the tumor cells. Next, there is also presence of the Rosenthal fibers and the eosinophilic granular bodies. Next, we look at the medulloblastoma. So what is there in the medulloblastoma? So medulloblastoma is nothing but there is a very dense cellular. It is very dense. It is cellular, and there are sheets of positive primitive appearing small blue cells. There are sheets of small primitive and appearing small blue cells. Next, there is also the individual tumors. There is individual tumor cells. So these individual tumor cells, they have a scant cytoplasm, as well as there is a hyperchromatic nuclei. There is hyperchromatic nuclei, and there are frequent elongated or crescent shaped. They can be elongated or crescent shaped. So they are elongated as well as they may be crescent shaped. Now, next there is the tumor cells from homocyte rosettes. The tumor cells form the homocyte rosettes. So they are nothing but there are pseudo rosettes, and they are with the central neutrophil. They have a presence of the central neutrophil. Then we move on to the ependyoma. The ependyoma. So this ependyoma is there is the ependymal rosettes are present. The ependymal rosettes, they are present, and they are nothing but a gland-like elongated structures. So they are gland-like as well as they are elongated structures. They resemble the embryological ependymal canal. They resemble embryological ependymal canal. Next, there is also they are with a long delicate process, and they extend to the lumen. Next, we will look at the perivascular pseudocytes. So what do you mean by this perivascular pseudocytes? So there is a perivascular nucleus. The perivascular nucleus, and this is nuclear free zone, and this consists of a thin ependymal process. We have a thin ependymal process. This radiates towards the central blood vessels. So they radiate to the central blood vessels. Next, we move on to the oligodendroglioma. Oligodendroglioma. So this oligodendroglioma, what does it have? There is a fried egg appearance. So what is meant by this? There are sheets of regular cells. The regular cell sheets. So sheets of regular cells are present, and they have a spherical nuclei. There's presence of the spherical nuclei, and they contain finely granular chromatin. They have finely granular chromatin, and it is similar to that of the normal oligodendrocytes. So it's equal to the normal oligodendrocytes, and it is surrounded by a clear halo. So it is surrounded by clear halo of the vacuolated cytoplasm, Next, we look at there is a chicken wire capillaries. There's presence of the chicken wire capillaries. So this includes a delicate network of, so there is a delicate network, and this is of the anastomosing capillaries. So delicate network of anastomosing capillaries. Then lastly, we look at the retinoblastoma. So this is composed of a small and round cells. So this there is a presence of small as well as there is round cells, and they have a hyperchromatic nuclei. There is a hyperchromatic nuclei which is present. Then there is also presence of the flexner. There is the flexner winter stainer. There is a flexner winter stainer rosettes. So they are nothing but the arrangements of a single layer of tumor cells. The arrangements of single layer of the tumor cells. And these tumor cells are around an apparent lumen. They are around the apparent lumen. Next, there is also the presence of the Homer. There is Homer-right rosettes. So they are nothing but a ring of cells with an eosinophilic fibrillary center. They are a ring of cells and they are with a eosinophilic. So they are with a eosinophilic fibrillary center. Then there is also the presence of the florets. There is presence of florets. So this is nothing but a retinoblastoma cells. There is a retinoblastoma cells and they have undergone a greater photoreceptor. So they have undergone a greater photoreceptor, and this is a photoreceptor differentiation and a group together as a bouquet. And the florets lack mitosis and or necrosis. So these florets, they lack mitosis or the necrosis.